Okay. This session is now being recorded, and it will be posted to the IPHA YouTube channel afterwards, so you can see it there or catch any that you missed. But now with that, I'll turn it over to Ann so she can introduce herself and tell us about the Research Center. Ann?
Great. Well, thanks. Hi, everybody. So my name is Ann Saba. I am a communications specialist with the University of Iowa Injury Prevention Research Center, and I'm really excited to be here today. I've been an IPHA member for a while. I've been with the center for about 6 years. So my role is to disseminate our research to different audiences like journalists and policymakers, our partners, and the public. So today I'm going to be talking about our research and resources to prevent injuries and violence. And I'm really going to be giving an overview, hoping to cast a wide net, perhaps touch on some of the areas that you work on. And as you see, as I go through the presentation, that injuries and violence is really a diverse field. And there are many different topics that are included under injury and violence. Okay, so just to introduce you to our center, we are one of 9 injury control research centers funded by the CDC. We are the most rurally located of those centers. So we have the advantage of having access to a rural population to do studies, which really makes us a unique resource in our state. We were the most Western of these injury centers until just about 3 years ago, and then Washington State got an injury center 3 years ago. We've been funded since 1991, so we just celebrated our 30th anniversary last year. So we aim to reduce the burden of traumatic injuries and violence, especially among rural populations, but we also do research in urban populations as well. And so we put our research into action through our partnerships, local, state, national, and international. And then we disseminate our research to different audiences to elevate injury and violence prevention. So we collaborate with about 65 faculty researchers around campus in about 25 different departments on campus at the University of Iowa. We organize around expert research teams. So these 7 teams are areas where we have maybe more researchers or more research funding, but we certainly work on other topics besides this. One of the ways we organize is we do these ideas labs where we get together and brainstorm some ideas. So off to the right, you can see that we did a transportation ideas lab, and we were looking into how to include equity and sustainability in all the work that we do. So I just put up this visual of our 3-year strategic plan, just so that you can see some of the buckets that we work in. So for example, we do research. Obviously, we are a research center. We train students at the University of Iowa. We also train professionals. We do outreach work. We do some policy research. We advocate for injury and violence prevention. And then we do diversity, equity, inclusion work in our research, training, and outreach. So I mentioned we're at the College of Public Health at the University of Iowa. So we have some injury and violence courses in our program. We also try to integrate injury and violence prevention content throughout the college in different departments across campus. We also collaborate with the College of Education and the School of Social Work for an undergraduate certificate in resilience and trauma-informed perspectives. So the burden of injuries and violence is great. Injury is the leading cause of death for people ages 1 to 44. So basically the first 4 decades of life, and injuries can happen to anyone, anywhere. We're all vulnerable, although there are certain populations more vulnerable than others, depending on what type of injury or violence it is. And one of the messages that we really want to elevate here at the Injury Center is that injury and violence are preventable. They're predictable. We have interventions to reduce them. So we really want to elevate this in our messaging. And one example is that it's very common for people to call car crashes car accidents. And we really want to get away from this word because we know how crashes happen. It could be from drowsy driving, maybe driving too fast on a wet road, or maybe looking down at your phone to read a text. So we really want to get away from that accident language. This is a visual of the 10 leading causes of death by age group in the United States. It's 2018 data. You can see here that from ages 1 to 44, unintentional injuries, which is injuries not done on purpose, are the leading cause of death in that age group. But you can also see that suicide and homicide are up there in the top causes as well for that same age group. And then just important to note that for our Black youth in America, homicide is the leading cause of death. And then the 10 leading causes of unintentional injury deaths, it really varies by age. If you look at the top, age 1 to 4, you're looking at drownings as being the top cause. 5 to 24, you're looking more at motor vehicle crashes. 25 to 64, you're looking at the poisonings, which is usually drug overdoses. And then that 65 plus age group, you're looking at older adult falls. And then our top causes, poisoning and motor vehicle traffic and falls. And then these are the 10 leading causes of violence related deaths. So you can see that for 10 to 65, suicide is up there in the leading causes. And then the 15 to 34 are particularly vulnerable to the deaths from homicide. So you have the lost lives due to injuries, but there's also an economic argument for reducing injuries and violence. So the CDC put out a new report that found that in 2019, injuries were costing Americans $4.2 trillion. And this is a quote from our director, Dr. Carrie Castile, about the pandemic has increased the urgency to prevent injuries and violence in our community. So during the pandemic, we're seeing increases in interpersonal violence. We're seeing mental health issues everywhere that could lead to suicide. And then we have accelerating overdoses happening in our country. So, when this current COVID-19 crisis is under control, we're going to have injury and violence issues in the aftermath. So, injury and violence prevention really needs to be part not just of COVID response, but also COVID recovery. So that said, we do have a COVID-19 resource hub for injury and violence prevention resources during the pandemic, and you can find this resource on our website. Some of the things we have there, so we have a compendium of secondary data sources available to explore COVID-19's impact on interpersonal violence and injury as indicated by gun ownership, gun violence, intimate partner violence, and family violence. We also have a published commentary that can help you learn how to use this tool. We also have some materials in Spanish and English on how older adults can stay healthy during the pandemic. And these materials were adapted from our Disaster Prep Wise intervention, which is an intervention to help older adults prepare for disasters. We also have a handout on de-escalation to prevent workplace violence during the pandemic. It has tips for conversations with employees, customers, patients, students, and clients. So this is especially important around things like maybe mask wearing policies where there could be some agitation in the workplace over this policy. And you definitely want to de-escalate that situation to prevent any violence from happening in the workplace. The Safe States Alliance is the largest professional organization for injury and violence professionals, and they just put out a new report about how COVID-19 is negatively impacting all levels of injury and violence prevention capacity. So if you're interested in reading this report, definitely check it out on the Safe States Alliance webpage to read more about it. We also have a monthly injury blog from our center. We started it a little bit over 5 years ago. We use this blog to share our research and also to highlight the work of some of our partners. So you see off to the right, we did an interview with Iowa ACEs 360 on addressing childhood trauma and this organization's partnership with Sesame Street in communities. And then I just listed some of the headlines just to give you some examples of our injury blog. You can see it's a very diverse list, and hopefully there is something there for everybody. We also have some COVID-19 focus blogs. So we did a blog post on rural injuries and violence at home during COVID-19. We put this one out when there was the shutdown and people were spending a lot of time at home. We also have one in older adult falls prevention during the pandemic. Another one on preventing childhood injuries outdoors. This was, I believe, last summer, as pools were closed, perhaps more kids were going into open waters, and how to stay safe in those open waters that have some different risks. And then we also did a blog post on mental health of families during COVID-19. And we partnered with the National Traumatic Stress Network for that blog. And then we have one on overdoses during the pandemic. So I mentioned that we have some rural expertise. So in rural America, death rates are higher from motor vehicle crashes, burns, drowning, and suicide. So rural areas are, they can be really great places to live. We have close-knit communities, beautiful landscapes, but they do come with some injury risks. So we have that geographical isolation, high-risk farming activities. In rural areas, there are gravel roads with 2-lane roads with no shoulders that can be dangerous. Long distances to social and preventative services, farther distances from hospital. So even, if we can't prevent that injury, well, we definitely want to prevent a worse outcome. And a lot of that depends on how fast you can get to the care that you need and to the hospital that you need to go to. There's also shortages of mental health care services in rural areas. And then having an unsecured firearm in the home is a risk as well. Some of our partners at University of Iowa, hospitals and clinic found that they did a survey on some rural youth in Iowa and found that about 50% have an unsecured firearm in the home, which is very concerning. So we do have also on our website a rural injuries resource hub where we include our blog posts on rural injuries and violence. We include some media articles that are highlighting some of our rural focused research, handouts about our work. We also have links to some of our rural partners that we work with. And then not there yet, but we'll be adding some new research publications as they come in on that resource hub as well. So I want to pause. I know that's a lot of talking, and this would be an opportunity for anyone to ask a question so far before I get into talking a little bit more about our research. I don't know if anything's come in the chat.
Well, if anybody has any questions, go ahead and unmute or just throw it in the chat, whichever you prefer.
You can certainly think of questions at the end as well. So I can go ahead if there's nothing. All right. Okay.
I don't see anything in chat.
Okay, great.
Go ahead if you like.
Yeah, so I just want to go over some of our research, sort of by topic area, to give you an idea of some of the research that we have at our center. So one area we work in is older adult falls. So we have research on medication deprescribing plans to reduce falls in older adults. We've done research on medical diagnoses associated with falls. We've evaluated falls and fire safety prevention programs. We've also tested tools and devices that predict frailty and risk for falling. And then we also recently did a survey on how organizations that work in older adult falls, how they collaborate in our state. And if you go to, this was actually the topic of our last blog post for anyone who's interested. Some of the resources that we have available, and these are all, again, on our website. We have a toolkit for establishing a community engaged network to refer older adults to falls prevention programming. So what our research has found is that there are a lot of falls prevention programming that works in communities, but there are some barriers for adults to participate. It could be things like access, transportation issues, affordability, or maybe lack of support from peers or their families. So we developed and tested a referral structure to get older adults to participate in these programs. So if you're interested in having this kind of referral program in your community, go ahead and check out our toolkit. We also do some work on opioid overdoses, mostly around, a lot of our work has been around addressing stakeholder priorities in Iowa. So in 2017, we gathered about 30 stakeholders across the state from a dozen different fields and came together to discuss the prescription opioid crisis. The stakeholders voted on their top priorities, and those were published in our report. And in 2020, we did the same thing, held another stakeholder meeting, this time to look at recommendations to reduce overdose deaths in rural Iowa. And we put this report out actually just before the pandemic hit, so it didn't get as much media attention as we would have liked, but both of these reports are available on our website for anyone who's interested. We also do research on child injuries. We look at child passenger safety and proper restraint use. So we go out across Iowa and observe children in their vehicles to see if they're properly restrained. And most of what we have found is that in rural areas, where we have room for improvement are getting that proper restraint use in rural areas. And also in getting the older child group, the teenagers, to wear their seatbelts. That's another area where we need improvement. We also study child bicycling safety, hazards on the road, maybe some of their risky riding behaviors. We study child pedestrian safety. We work with faculty at the Hank virtual lab at the University of Iowa. They study how children cross the street using a simulator, which is really cool. We also look at pediatric fall injuries, and we have some research on burn injuries and adverse childhood experiences in that burn population and their parents. And some of the resources that we have available, we have an inventory of youth bicycle education programs. So we studied youth bicycle education programs around the country, and this report includes what should be included in a comprehensive bicycle education program by age. So if anyone's interested in that. We also have burden of injury in Iowa County reports on our website. You can just press your county and get a report on death rates from falls, suicide, road traffic crashes, poisoning, and homicide. The data is a bit old, but hopefully we'll be updating that soon. We also have a Preventing Childhood Injury conference every September for anyone who's interested, and we partner with Blank Children's Hospital on that event. Some of our agricultural safety research, we did some research that found that farmers have the highest suicide rates than any other occupation in the country. We also have done research on medications while driving farm equipment, considering that farmers tend to be a little bit older, perhaps taking medications to manage their health problems. We've also looked at farm equipment crashes on and off the roads. Our research found that proper lighting and marking on farm equipment can reduce a crash by over 50%. We also look at vehicle interactions among farm equipment. Most often, the fault of the crash is the vehicle driver and not the farm equipment operator. And then we also look at non-fatal tractor injuries, with rollovers of the tractor being the most common injury. So we work with several partners to share our rural focused research. One of them is the Great Plains Center for Agricultural Health. They're a center at the University of Iowa College of Public Health. They have a new Farm Safe podcast where they share a lot of rural research. So if you're interested in this area, definitely check out this podcast. We also work with IPHA, Iowa Center for Agricultural Safety and Health, also at the College of Public Health. And they have a lot of rural partners, rural and farming organization partners that they can go ahead and share our research. They have more access to those rural partners than we do. We also do some occupational injury research. Of course, we have those farming injuries. We also have studied workplace violence, both in big corporations and small businesses. We study violence against youth workers. We have someone on our executive committee who is doing work around worker mental health and well-being during the pandemic. And then we have some recent research on motor vehicle crashes due to weather on the way to work. And these are some of our partners also. These are centers at the University of Iowa College of Public Health. One is the Healthier Workforce Center of the Midwest, and the other is the Heartland Center for Occupational Health and Safety. And all these centers have their own website, so definitely check those out on your own. We also do transportation and rural road safety research. So we study dangerous features of rural roads. We study ATVs both on and off the roads. Riding an ATV on the road we've found is more dangerous than riding off-road. We study teen drivers on rural roadways. We're currently doing a study looking at adult rear seatbelt use. So in Iowa, the law is adults only have to wear their seatbelts in the front seats, whereas children have to wear, a seatbelt or proper child restraint everywhere in the car. So we're looking at the impact of injuries and death due to those injuries, and also the economic cost of those adults not using their seatbelts in the back seat. And then we do some research on bicycle safety, not just on the roads, but on the sidewalks as well. And then we partner with the University of Iowa National Advanced Driving Simulator, where they do simulation studies to look at things like drowsy driving and impaired driving. And these are some of our resources. We do infographics. So these first two infographics you can find on the Iowa Department of Transportation website. We partner with Iowa Department of Transportation. We also developed and tested Steering Teens Safe, which is an intervention for parents to help motivate their teens to be safer drivers. And we are currently implementing this and testing this program in Columbus, Ohio, with our partners at Nationwide Children's Hospital. So this intervention is not available to the public yet, but definitely stay tuned about that. And then some of our violence research, we have looked at interpersonal violence reported by rural women. We have also looked at distance to the nearest domestic violence service. We are starting a study that is studying the implementation of a teen dating violence prevention intervention in a couple of rural middle schools here in Iowa. We've also studied anti-bullying laws in the US. We've evaluated Iowa's anti-bullying law. And we've also looked at teen versus parent responses to cyberbullying, which are very different. And then we also look at suicide. Some of our resources that we have on our website, well, actually, this is on a separate website. If you go to hereproject.org, you can see an intervention that we have. It's called Here, Helping Educators Use Art to Reduce Bullying. And it's aimed at teachers, maybe youth group leaders, and it has some arts-based activities that you can use to teach kids about reducing bullying. And it has things like writing activities or drama activities or maybe a social media campaign. So feel free to check that out on that website. And then we also do policy briefs. This is an example of a policy brief that we did looking at the laws in 25 different states and what was effective about those laws. So we partner with the Iowa Department of Public Health on the Iowa Violent Death Reporting System, which is a relatively new surveillance system, CDC funded, that we have in our state that looks at the deeper context of violent deaths in our state. So together with the IDPH, we put out suicide in Iowa reports every year. So we have reports from 2015 to 2021, and we are currently working on our first homicide in Iowa report, and hopefully that will be available soon as well. And if you are interested in these reports, they're available on the IDPH website. We also have a YouTube channel. So these are some of our webinars that we have on our YouTube channel. We have one where about research methods to evaluate firearms policy. So we gathered firearms research experts from around the country for that webinar. And then we partnered with the DEI committee of the College of Public Health for a webinar around community violence and trauma. So feel free to check those resources out as well. And then our research for trauma care, we have looked at firework injuries following the legalization of sales in Iowa. We also have looked at private vehicle transport of pediatric trauma patients. We found that for pediatric trauma patients with severe injuries, as many as 43% arrive at the hospital in their cars and not in an ambulance. We also look at under triage pediatric patients. So under triage would be, patients not arriving at the proper hospital that can handle the care that they need for their injury. We also look at trauma care for injured farmers. We have found that farmers have about an hour delay in care compared to other occupations. If you think about farmers, they might be, working in a remote area. Maybe they're working alone and it takes, someone longer to discover them. And then we also do research on helping older adults prepare for disasters, such as floods and tornadoes. Some of our resources on our website, we have a policy brief on our fireworks injuries work, which found that, not only are firework injuries more since the legalization of sales in Iowa, but the injuries are more severe and they're also affecting more children under 18. And then our work on ACEs, we tested a psychological first aid for injured kids. So injuries are traumatic for kids, it pulls them out of school, they lose their connection to maybe peers from activities that they can't participate in anymore. And at worst case, they could become disabled from their injury. We've also tested a psychological first aid for traumatized kids in school, keeping in mind that school nurses are often on the front lines to identify kids who might be experiencing trauma in the home. We have studied the effects of childhood trauma on cardiovascular health later in life. We do this we have a sample of African-American adults who have participated in this study for over 2 decades. And then through that research, we've also found that fading memories is a challenge for child trauma research. We've also looked at the role of supportive parenting to buffer some of the health effects of that childhood adversity. And then in the same African-American adult population, we have looked at how incarceration and neighborhood violence is affecting biological aging. And then some of our resources, we have some resources that highlight some of that research I just talked about. These resources are available from our partner, the University of Iowa Public Policy Center, but you can also find them if you go to our ACEs web page on our website. Okay, so this is a great place to stop if there are questions. Let's see. Oh, that March 1st webinar, sorry, the webinars that I talked about have already happened, but I can, so you don't have to register for it, but I can send a link, a YouTube. So if you go to our website, here, I'll just, because I don't know the exact link, I can put it in. This is our website, and if you go to the top, there is a link to our YouTube channel, and that's where you can find our webinars and videos. So definitely check those out. Thank you. Any other questions? I'm going to change gears away from research into another topic.
So any other questions, you can go ahead and unmute from the chat, or we can save them for the end.
All right. Well, keep thinking because we still have the end to answer questions. So I wanted to switch gears now and talk about some of our communication and outreach strategies. So one thing that we do at our center is we participate in National Injury Prevention Day, which is every year on November 18th. This past November was the 2nd annual Injury Prevention Day, and it is led by the Injury Free Coalition for Kids. And the goal of the day is to raise awareness around the burden of injuries and violence. And this is a picture of some of our team. We have a much bigger team, but this was the team that was available for a photo that day. So some of the activities around the nation. So people around the country participated in the Be Injury Free Twitter chat, which reached about 6.5 million people around the world. So hospitals and local health departments and organizations did their own outreach activities. They did press releases and social media posts. There was also a Zoom background that you could use to promote the day during your virtual meetings. Some organizations sought state or city proclamations declaring November 18th National Injury Prevention Day. And then hospitals, buildings, and bridges were lighting up green to promote the day as well. So our center's activities, we collaborated with the Iowa Department of Public Health for a podcast on injury and violence prevention. We also collaborated on an injury prevention toolkit, which is available on the IDPH website. And then we sought a proclamation, and we got one from Governor Reynolds declaring November 18th National Injury Prevention Day. And then below you can see the University of Iowa College of Public Health lighting up green for the first time, which we are really excited about. And I would definitely encourage anyone who's interested to participate in this day. It's a very exciting day. So hang on a second. So if you go to the Iowa Department of Public Health website, there is a social media toolkit that you can use for National Injury Prevention Day. So you don't have to create your own materials. They have images that you can use on your social media. It just makes it a lot easier for you. Maybe you don't have the bandwidth to create your own images to promote the day. We definitely have ones that you can use. And then I just wanted to highlight here that in Iowa, most unintentional injuries are from falls, motor vehicle crashes, and poisonings. Another strategy that we use is to participate in Twitter chats. So Twitter chats are a great way to share resources, learn about new resources, and maybe connect with partners that you that you're not aware of. These are some examples of some Twitter chats that we have participated over the last couple of years. A couple of them are on how to keep safe during the COVID-19 pandemic, looking at injuries and violence. We also participated in a safer storage Twitter chat on gun safety, and then we did another Twitter chat on National Injury Prevention Day. We also do visual abstracts. So visual abstracts are a relatively new way to share new research. So these are usually they're shared on Twitter, and they're just like visuals of like key findings of a new publication. And then if you're interested in reading the full publication, you can just click on the link to the full publication. If you want to see some more examples of visual abstracts, you can go to our Twitter handle, which I have included there at the bottom. Another strategy we use is to take advantage of public health observances. So for example, we did a blog post on preventing youth suicide, and we put that out during National Suicide Prevention Week. And then we share our bullying prevention materials during National Bullying Prevention Month. So I think, taking advantage of these observances is just another way to be part of the conversations that are happening around these certain topic areas, and during a time when there's a lot of momentum around that topic. This is a resource that we have on our website. It is a guide to writing and disseminating policy briefs. So anyone who is interested in advocacy work. It's a guide for injury and violence researchers and practitioners. It's targeted towards injury and violence people, but really it can be used for any issue, whatever issue that you're working on. It's just that the examples in the guide are injury and violence. So my last few slides are going to talk about just some of the things we have upcoming in the next year. One of the things we are going to be working on is doing an ideas lab around sexual assault in the military, gathering our research and practice partners together, hopefully to come up with some kind of white paper that talks about the state of evidence and the research priorities and the practice opportunities in this area. So if this is an area that interests you, or perhaps you have a partner that might be interested in this, feel free to reach out to me about this. We also are doing some work with tribal populations. We have an intervention called Disaster Prepwise. which helps older adults prepare for disasters. And we're going to be adapting this to Indigenous populations, working with the Meskwaki tribe in Iowa. And then we're also going to be working with the Iowa Department of Public Health to interview schools around Iowa about their process of return to learn and return to play policies after a student has a concussion. And then finally, we have been working with the Iowa Department of Public Health for a 3-year injury and violence prevention state strategic plan, which identifies strategic priorities for preventing injury and violence. And this had the input of around 30 public and private organizations in our state. And I believe the plan is for the IDPH to release it in early February. So definitely stay tuned and look out for that. It's in the process of being finalized. And before I get to questions, I want to put a plug for my definitely my email. If you have any questions about any of the resources or research I talked about today, or anything, any other way you want to connect, this is my email. Also, our Twitter handle for our center. I also have a Twitter handle if you're interested. And then if you want to subscribe to our monthly blog, you just go to our homepage and press on, there's like a subscribe button there. And that is it for me. I'm ready for questions. I also have questions for you, but I would love to hear if any of you have questions first. I feel like I've been talking a long time. And if we don't have questions, I would love if people could put in the chat to start off. I would love to see where people are coming from. If you do work in an area of injury and violence prevention, or I would just be interested in where you work as well. Feel free to drop that in the chat. Okay, local public health, great. We got some substance abuse. Yep. I mean, one of the great things about injury and violence is that, you know, it affects so many people, and also there are so many topics under that. So I can see I'm definitely, yep, area agency on aging, great. These are all, yep. Pretty cool. Local public health, substance misuse prevention, perfect. Oh, we definitely have some of you that are working, and we definitely want those local public health people as well. Lynn County, perfect. Great, well, thank you, everyone. What about, I was just wondering from you all, you know, maybe the third question, you know, what type of resources might be most beneficial to you? I'm thinking topic area, maybe, you know, is it, you know, fact sheets about a certain topic or policy briefs? What might be, there's one, yeah, gun violence. Yeah, we have road safety. We have a really big range here of people today. That's great. Lots of injury and violence people. So I would be definitely interested to hear what kind of resources might be helpful to all of you. And then also feel free to ask a question as well. Great, I love seeing all the areas coming in. Thank you, everybody. Aging, opioids, all there, gun violence, great. I don't know, I guess there's no questions.
Well, if there are any questions,
Yeah.
go ahead. You can turn your camera on at this point, unmute, come in and chat, or just throw it in the chat here in Zoom. Or
Oh, I see.
if not,
Oh, I see someone saying that a white paper on gun violence to use at community meetings. Thank you for that. That would be beneficial. Yeah, and definitely check out those the suicide and homicide reports on the Iowa Department of Public Health for anyone who's interested in gun violence as well. All right.
All right, well, if there are any questions, just go ahead, ask them. Otherwise, I think go ahead and wrap it up a little bit early. No problem with that.
Yeah.
But just go ahead and interrupt me in the chat or unmute if there's any questions. Otherwise, I think I'll go ahead and wrap us up here. So thank you, Ann, for sharing your expertise with us today. Thanks to all of you who came here and shared your lunchtime with us. I hope you can join us again next month. I think it'll be on the 17th of February. We'll be joined by Bethany Snyder, Lori Walkner, and our ED, Lena Tucker-Reinders. We'll talk about workforce development and the IDPH HHS alignment. Our education committee is always looking for more topics for future lunch and learns. We welcome your ideas to showcase your work and any others. We encourage anyone with an interest to join the committee. Just a reminder, as a nonprofit organization, IPHA relies on membership dues and sustaining donors to support our mission. If you're not already a member, please consider joining IPHA. If there's any students here, you can check with your department chair. Some programs have funds to help support your membership. If you are a member, we thank you. We appreciate any donation that fits within your budget. You can join and give at iowapha.org. The recordings of all lunch and learns, including this one, will be archived on our YouTube channel, Iowa Public Health Association. You'll also find any other webinars that you may have missed or want to revisit. Thank you again. We'll see you all next month, hopefully. Thanks, Ann.
Thank you.
Have a good day, everybody.